So I've been given the task of talking about knee injury prevention, which is a pretty broad topic, so we'll narrow it down and you'll get to that. So kind of my objectives for this are to talk about the prevalence in knee injuries and kind of give a little bit of background there, and then kind of talk about some mechanics importance of protecting the ACL and some programs to help with that. So there's a lot of people participating in sports, as you guys all know, and it's got all the positive things that I try and instill in my kids, fitness, coordination, teamwork, but unfortunately there's also this higher risk of injury, and that's what keeps me in business, but at the same time I think it's still worth playing sports. There's about 3.5 million sports injuries for kids less than 15 that treated in medical settings annually. About a quarter of emergency room visits come from this. And so for kids involved in organized sports, there's a lot of physician visits, the hospitalizations, and luckily most of these are minor, that don't require a lot of time from sports or probably repeated visits, but we see them. This is kind of the age range I'm in with the top picture here, so less than 10 years of age. These are usually people learning how to do things for the first time. Bike riding, roller skating, sledding, that's a lot of what I see in my practice. And if this is my kid, if there's blood coming there, this is the worst injury he's ever had, and you think he's going to lose his leg. As you get older, then there's more force involved with these things, and so these typically happen more during the organized events, wrestling, basketball, football, soccer, and so that's kind of what we'll focus on a little bit as we move forward. See both acute and chronic. Acute is things that happen from a one-time specific injury. The chronic overuse, and I won't get on my soapbox too much here, but we're seeing more and more of that as kids start specializing in sports at a younger age. You know, when you start playing soccer at age 6 and not playing another sport, you start seeing more of these overuse type injuries. And so pitching is one that everyone knows about, the elbow injuries with that, and cross-country running is another common one. So the knee has lots of different aspects to it. We'll focus in more on the ACL, but you've got your cruciate ligaments, your collaterals, your meniscus, your cartilage, your patellar tendon. These are all things we see very commonly with injuries. But that's a really broad topic to talk about knee injury prevention for all these things, and so I'll focus in a little bit more just on ACLs. And so what is the ACL? It's one of 4 ligaments in the knee. It really tries to help keep your tibia, or your lower leg bone, from moving forward, and then also helps with some rotational stability as well. And so how often these happen, there's about 250 ACL tears a year with a $5 billion annual cost, and the problem with these injuries is, as you guys all know, is it keeps you away from playing sports for a long time. The good news is that with treatment that there's a high rate for people coming back and playing. And so how do these happen? Contact versus non-contact. About 80% of these injuries are non-contact, meaning that no one hits you to make it happen. These are more commonly seen with landing type things, soccer, basketball, skiing. About 20% of these are contact, so more kind of the bottom picture there, someone else hits you and your knee folds in. So with non-contact injuries, this usually happens with landing or rapidly stopping and trying to cut and turn in a direction at the same time. And so that would be the most common thing. There's no right or wrong answer for how people get hurt, but that would be the one you see the most. And females have a 3 to 6 times higher risk of having a non-contact injury compared to males. So the prevalence, high school age, they estimate about 1 in 250 for men, whereas it's 1 in 60 for females. And as you get to collegiate level, it gets even more common for ACL injuries. What makes females more at risk? And so this isn't really anything that females can control more. It's some anatomy type things. In general, wider hips, smaller knee joints, some increased laxity. Their ACL itself is a little bit smaller that might lead to it. And then the things that I'll concentrate a little bit more as we go through this program would be different patterns of movements and muscular imbalances, things that we can try and highlight and maybe change. Can't change anatomy all that well. So what's the research? The research has shown that neuromuscular training, including plyometrics, balance, and technique training specifically for jumping and landing, can reduce the risk for serious knee injuries. There's a lot of current preventative programs that center mostly on those neuromuscular things. And so the goal with these treatment programs is to change the way you fire your muscles to help protect your ACL. So there's a lot of different ACL programs out there, and this isn't necessarily just a female thing. It's been shown to help with males as well. But there's really kind of, in general, lots of trends with each of these programs. And so typically there's a three-phase thing. And they've shown with the literature that this is better to start not necessarily right when you start your season, but actually about 6 weeks ahead of time so that you can have the neuromuscular training to help prevent this once you start playing. And so the first phase is usually 1 to 2 weeks. It's early in your preseason. I don't know why they differentiate phase 1 and 2 because it's just weeks. But then after that, it becomes in-season maintenance. And it's been shown that you should do this 2 to 3 times a week for 10 to 15 minutes. And so it can be part of your practice as like your warm-up. I think that comes down to coaching and things like that. Or it can be done ahead of time, but it shouldn't be, you know, at the end of your practice. That's when your muscles are fatigued and you're more likely to have these injuries or issues still. And so you can always do your standard warm-up prior to the program, but I think that then you can also do your standard conditioning and strengthening in addition to this. This doesn't replace hitting the weights or going to the weight room or training. So the basic components of all these programs involve a warm-up where you're just trying to get things moving, followed by stretching, which I would say almost all the time now is dynamic. It's not like getting in a circle and doing the flamingo like it was when I was growing up. Now these are dynamic stretching. Then some strengthening type things, which is really focused on the hip and thighs and hamstrings. And then plyometrics when you're talking about jumping, landing, and quicker movements, as well as some agility things. So why do you do this? The whole idea is that the quad helps extend your knee, and so that puts more of an anterior force on your ACL. And so if you have an imbalance of these muscles, that can, if your hamstrings don't work in unison, which helps protect your ACL, actually it helps pull back your tibia. And so the idea is that with your hamstrings firing when you're landing, it's actually taking the pressure off your ACL. So landing with a bent knee with your hamstring firing actually helps absorb the force and less through your ACL. So if the balance between the hamstring and quad muscles is really important, they recommend that your hamstrings be at least 60 to 80% as strong as your quads. That doesn't include your hip muscles, which are really important also. Your knee buckling in, which I think you'll see on one of the next slides, is important. So that's where these programs focus. And so landing technique is the other big one, and that's where it helps to have a trained person doing this with you, an athletic trainer or a coach that's been used to this, and so they can critique you on this. It's not necessarily just going through the motions, you got to do it the correct way. So landing on the balls of your feet, kind of landing softly with your knees flexed, your chest over your knees, and you don't want your legs kind of bending too far in or out, and then kind of landing with equal weight. And so we think we're doing this, but you don't want to be going through the motions. You want someone to be double checking you. So this is kind of in general what you're looking for. The one on the left is a good landing. Your knees are directly over your feet. The bad landing would be the one on the right where your knees are kind of coming inwards. And that's what you see more frequently, unfortunately, with female landing, is that they've got more of that valgus directed force. So these programs the goal is to critique you and kind of work on these before your season starts. So the research has shown that the development of these training programs is evolving quickly, but it's shown up to 70% of improvement in non-contact ACL injuries and up to 40% improvement of all ACL tears. And so I think these programs are showing a lot of promise. Local options in the near future with athletic trainers, we're hoping that we can start some of these programs and at least start trying to identify people that have some of these muscular imbalances through testing to help prevent ACL tears, especially in some of our post-operative patients, maybe some testing before you go back out to play to show whether or not you have the imbalance with your quad and hamstrings or your gluteal muscles or things like that. And then hopefully as well, starting some of these programs prior to seasons with our different schools and clubs in the area so that we can prevent these injuries from coming.